Hello everyone, Dr. Neha Garg here. Welcome back to Healthy Buddha, where we blend ancient Ayurvedic wisdom with cutting-edge science. Today we are diving into the tricky and often misunderstood gut issue which causes severe constipation. It is the slow transit constipation, also called STC. If you've been loading up on fiber, drinking enough water, even trying probiotics, yet your bowels feel more like a parking lot than a moving highway, then this video is for you. What is slow transit constipation? Constipation can happen from two common causes. The first one is called functional constipation, which is what most people have. And that happens mainly due to a low fiber diet, processed food diet, dehydration, or pelvic floor muscle weakness. To get solutions for functional constipation, please watch our prior video on 5 simple ways to get rid of constipation. Today, we will look at the second and more severe type of constipation, which is the slow transit constipation or STC, where the problem lies deeper. This happens when the colons, nerves, and muscles become sluggish, leading to poor intestinal motility. It tends to affect women more. The underlying cause can be due to dysfunction in the colonic nervous system, loss of pacemaker cells of the colon, which are called the interstitial cells of Kegel, or due to underlying conditions like hypothyroidism, side effects of certain medications like opioids and certain antidepressant, and last is chronic laxative abuse, which can also weaken the smooth muscles of the colon. People with STC tend to have brittle, dry stools even when they are eating a fiber-rich, plant-based diet. And that's the key difference. STC is not a food problem, it's a motility issue. Let's see which laxatives are effective in STC. Many people reach for over-the-counter laxatives, but not all work the same. Traditional stimulant laxatives like Senna and Bisacodyl are often ineffective in STC because they do not correct the underlying nerve dysfunction. And in fact, long-term use of these stimulant laxatives can cause dependence and more harm. Osmotic laxatives like polyethylene glycol or Miralax and magnesium citrate, they work by drawing out water into the colon, which softens the stools. They have shown better consistency in stool frequency in STC, but they do not treat the underlying colon motility issue. Last is the newer generation agents like prucalopride. Prucalopride is a prokinetic agent that stimulates serotonin receptors in the colon and actually improves the colon transit time, leading to more normal stool frequency. It is most effective in STC. In a 2008 NEGM study, prucalopride significantly improved bowel frequency and reduced colon transit time in patients with confirmed STC, outperforming placebo by a wide margin. Let's look at this from the Ayurvedic perspective. In Ayurveda, this is seen as a Vata imbalance, specifically the Apana Vata, which is the downward moving bioenergy that is responsible for elimination of stools and urine. When Apana Vata is blocked or depleted, then you get dry, hard stools, irregular or absent urges, gas and bloating, and sometimes lower back pain and anxiety symptoms. So how do we restore this Vata balance? Let's go over a few powerful Ayurvedic tools. Number 1 is castor oil or Iranda Telam. This is a powerful Vata balancing oil which acts as a natural bowel cleanser. For minor constipation, you can apply a few drops of castor oil around your belly button at night time and massage in clockwise direction. But for severe constipation as an STC, take 1 to 2 teaspoons orally at night with warm ginger tea. Oral intake of castor oil can be very helpful in stubborn or long-standing cases of STC. And always remember to consult with your physician first if you are taking any prescription medicines. Do not use castor oil in pregnancy or if you have inflammatory bowel disease. Second is cow's ghee with warm milk or warm water. When you take 1 teaspoon of cow's ghee with warm milk or warm water at bedtime, it helps in lubricating the colon and softens the stools. Ghee contains short-chain fatty acids, which are an essential source of energy for the colon health. It balances dryness and pacifies Apana Vata. This is not a miracle cure, but it becomes effective after about 3 weeks of regular use. This is safe for children, adults, and pregnant ladies. Third is Triphala powder or capsules. It is a gentle colon tonic that improves peristalsis over time. You can start with a 250-500 milligram at night time and adjust as needed. But just like other medicines, Triphala cannot be used indefinitely. You can take it daily for the first 3 to 4 months, but the maintenance dosage should just be 2 or 3 times in a week and not more than that. And again, if you are on prescription medicines, consult with your physician first. Next, we will look at some yoga asanas and pranayama for STC. The power of movement and breath cannot be underestimated. First asana for STC is Vajrasana. Sit on your heels for 5 to 10 minutes after your meals. This promotes digestion and it directs Apana Vata towards the left colon. Second is Malasana. This yogi squat straightens the anorectal angle, making elimination easier. Use a support of a wall if needed and try to maintain the pose for 1 minute or more. The best pranayam for STC is Anulom Vilom or alternate nostril breathing. This is a powerful grounding practice, and if done correctly, it calms the nervous system, rebalances Vata, and improves vagal tone, all of which are crucial for gut motility. Over time, these practices retrain the gut-brain axis, the highway that connects your emotions, hormones, digestion, and elimination. This brings us to the end of today's video and a quick recap. Slow transit constipation is not just about what you eat, it's about how your colon moves. Stimulant laxatives are a temporary fix, while prokinetics like prucalopride show the best results in studies. But don't ignore the wisdom of Ayurveda with castor oil, ghee, and Triphala that can help restore Apana Vayu. Pair that with Vajrasan, Malasan, and Anulom Vilom, and you are on your way to a happy, healthy colon. Drop a comment below if you've tried any of these remedies. Please like, share, and subscribe for more integrative gut healing tips from Healthy Buddha. Until next time, stay light, stay regular, and stay radiant.